Josh, so today I'm going to do an assessment on your musculoskeletal system and I'm going to be checking your strength as well. So I'm going to start by checking your temporomandibular joint. So I'm going to go right in front of the tragus. I'm going to have you open your mouth for me. Okay, close it. Move it side to side and protrude and retract. Okay, thank you. I didn't feel any clicking or popping and he had full range of motion. Okay, so now I'm going to check your neck and your cervical area. Is there any tenderness in or around here? No? Good. Okay, so I'm going to have you flex your chin down. Good, and then bring it back. Good, now bring it all the way back. Good, now you can bring your head back to normal. Now can you touch your ear to your shoulder? Good, and then the other side. Good, and just move your head like this. Okay, good. Now I'm going to have you push your head up against my fingers. Okay, a little harder. Good. And now back. Okay, and then this way. And then this way. Okay, good. You have full range of motion and your strength is +5. Okay, Josh, so I'm going to start by looking at your spine. So looking at your cervical area, I can see that it is concaved. And then moving down to your thoracic area, it's convected, so it goes in. And then down here at your lumbar area, it's concaved as well. So I'm just going to feel down your back. Do you have any tenderness at all?
No.
Okay, good. So I'm just going to feel your shoulders. Make sure they're nice and straight and aligned. And then your hips, they're nice and aligned. Okay, so I'm going to have you actually bend over. I'm going to take a look at your spine to make sure everything's straight. Yep, it's good, so you can stand up. I'm going to actually have you face this way, and I'm going to have you hold your hands right here. Okay, now can you flex back for me? Okay, good, so that's hyperextension. Then stand back up. Good, so that's just extension. Then with your arms by your side, can you lean this way? Yep. Okay, now lean the other way. Okay, and can you rotate from one side to another? Okay, good, you have full range of motion. Okay, Josh, so now I'm going to take a look at your shoulders. Is there any tenderness here? Just feeling bilaterally. Good, so now I'm going to ask you to take your arm and move it up for me. Good, that's flexion, and move it back down. That's extension, and bring your arm back. Good, that's hyperextension. Now bring it back to normal. Now you can move your arm out. That's abduction, and move it back in. That's adduction. Now can you take your arm and just put it kind of like a soldier, like that? Good. That is internal rotation. And then move it up like this. Okay, and that's external rotation. And you have full range of motion of your shoulders. And can you just push back on my hands? Good, and you have +5 strength as well. Okay, Josh, so now we're going to move onto your elbow. Is there any tenderness at all here? Okay, and I don't note any swelling or bogginess. So to check range of motion, I'm just going to have you bend your elbow. So come up, that's flexion, and come back down. Good, that's extension. So I'm going to have you put your hands this way. Good, that's pronation. And then this way with the palms up, that's supination. Now you have full range of motion. And to check the strength of your elbow, I'm going to have you push up against my hand. Okay, push down. Good. You have full range of motion of your elbow and +5 strength equal bilaterally. Okay, Josh, so I'm going to palpate your wrist. Is there any tenderness or anything here?
No.
Okay, and I don't feel any bogginess or note any swelling. So I'm going to have you do is flex your wrist for me and bring it back up to extension. Okay, now hyperextend. Good, so I'm going to have you put it back down and go this way. That's radial deviation, the other way. Good, that's ulnar deviation. For strength, I'm going to have you push up on my hand. Good, push down on my hand. Good, you have full range of motion and +5 strength. Okay, so now I'm going to look at your fingers and I'm going to palpate each joint. And I don't see any visual deformities, any nodules, or masses or swelling. Is this tender at all?
No.
Okay, so now I'm going to have you make a fist. That's flexion. Go like this. That's extension. And then I'm going to have you open your fingers, and that's abduction. Okay, now bring your thumb across your hand. Good, and that's flexion of the thumb. Now I'm going to check your strength. Can you squeeze my 2 fingers? Good, Okay, and then I would do that on the other side. And now I'm going to have you can make the okay sign and don't let me pull your fingers apart. Okay, good. You have +5 strength of your fingers and thumb. Okay, so now laying down, I'm going to check the range of motion of your hips and your knees. So I'm just going to palpate right here. Any tenderness at all?
No.
Okay, any tenderness here?
No.
Okay, good. I'm going to have you bring your leg up towards you. Okay, good. So that's flexion and back down. That's extension. Okay, now bring your knee towards you. Good, and that's flexion of your knee, and you can bring that back down now. And now bring your leg out towards me. Good, that's abduction back to you. Good, that's adduction. I'm going to have you push up on my hand. Okay, push down on my hand, and I would do that bilaterally. Okay, so I'm going to have you bend your knee. Okay, and bring your knee towards me. Good, that's abduction of your knee, and that way, that's adduction of knee, and push against my hand here. Yeah, and push against my hand here. Good. So you have full range of motion and +5 strength of your hips and knees. Okay, so now moving down, I would palpate your ankle for any bogginess or swelling, as well as your Achilles tendon. And I would check all your toes to see if there were any deformities or nodules, and I don't see any. It looks good. So Josh, I'm going to now ask you to bring your toes up towards you. Yep, that's flexion, and that's for dorsiflexion, and back down. Good, that's plantar flexion. Now I'm going to bring your have you bring your feet in together for eversion, and then out for inversion. Good. Now press your feet against my hands. Good, and this way. Good. You have full range of motion of your feet and ankles, as well as +5 strength in your feet and ankles. Okay, so now we're going to check the strength of your knees. So just push up against my hand. Good, and back. Good, so you have full strength of your knees. So now we're going to do 2 tests to test for carpal tunnel syndrome. So the first one is called phase sign. So just go like this for me. And we're putting your hands in acute flexion, so right here. So we want to know for any numbness and tingling. Are you having any right now?
No.
Okay, and you'd have the patient stay like this for about 60 seconds. And since there's no numbness and tingling, that's a negative sign. So you can put your hands down. The other test is called the Tinel test, or Tinel sign. So I'll just have you hold your hand out like this, and I'm going to tap right along the medial nerve. Okay. Do you have any pain over here when I tap?
No.
Any numbness or tingling?
No.
Okay, so both tests were negative findings. Okay, Josh, so today we will be doing an assessment on the nervous system. So I'm going to start assessing the patient as soon as you meet them. Start seeing if they're alert and oriented. Now I'm going to move on to the cranial nerves. So the first cranial nerve is the olfactory nerve. So I will have you occlude one of your nares for me and breathe. Yep, and then I would have him do the same thing on the other side, so that shows that it's patent. So now I'm going to ask you to close one of your eyes and ask you to smell this. Okay, what do you smell?
Cinnamon.
Yep. So he was able to tell me what scent it was, and then I would do that bilaterally. And I would have had him occlude one of his nares. Okay, so the cranial nerve number 2 is the optic nerve, and I would use the Snellen chart, which I used in the 3rd video, and having you read the newspaper 14 inches away from your face in small print. Next, we would do the confrontation test. I'm not going to do that today because we checked it in the 3rd video, but it's checking your peripheral vision, and I would have you occlude one eye and tell me when you see my wiggling fingers. Okay, so next we'll check cranial nerve number 3, 5, and 6. We would check them all together, and in a previous video I used my light source and shined it in one eye and watched it constrict, and then I did it again in another eye and watched that one constrict, so it directly constricted and then concentrally constricted. And then accommodation and extraocular movements were also checked in the 3rd video. Then cranial nerve number 5 is the trigeminal nerve. We can check this by placing hands over the temporal area. And can you clench down for me? Clench down. Okay, good, thank you. And then in the mastoid area, do that again. Thank you. And by having you clench your teeth. Another way to test that cranial nerve is to do the sharp and dull test. Normally it's done with a paper clip, but I can do it with a pencil. So this is the sharp and this is the dull side, so let me know which one you feel.
Sharp, 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 dull.
Okay, good. Okay, so now we'll move on to cranial nerve number 7, and that's your facial nerve. So I'm going to have you raise your eyebrows, clench down your eyes really tight, good, smile, good, and you have good facial symmetry. And to test cranial nerve number 8, we did that actually in week 3. I showed you how to do the Renee test, the Weber test, and the whisper test. Okay, and to check cranial nerve 9 and 10, I'm going to ask you to say ah. Take your time now. Good. So when you say I can see the soft palate rise and fall. I could also elicit a gag reflex and touch the soft palate with a tongue depressor. Next, for cranial nerve number 11, that's the spinal accessory nerve. So I'm going to ask you to push up against my hands. Good. Now push your head this way. Twist my hand. Yeah, push it away. Now this one. Okay. You have good strength for number 11, and for cranial nerve number 12, I'm going to ask you to stick out your tongue again. Good, and it's good, it's intact, and it's nice and midline. Okay, so now I'm going to check your gross motor strength. So I'm going to have you walk about halfway down here. Okay, good, then back. Okay, and now walk towards me heel to toe. Okay, good, you can go back to where you were. Your walk is upright, you have appropriate hand movements, you were steady. So now I'm just going to have you sort of do a little knee bend and stand on one foot. Okay, and now the other side. Good, now to check your balance, I'm going to do the Palmer drift test, so you can come right up here. So I'm going to have you close your eyes and then hold your hands out like this. I'm going to stand by in case you get dizzy. Close your eyes. Okay, thank you. So you had good balance. If your arm moves down at all, that would be a positive Palmer drift test. Now we're going to do the Romberg test. I'm going to have you put your hands by your side. Good, and close your eyes. Okay, he doesn't have any swaying, but if there was slight swaying, that would be normal. It would just be if there was a lot, that would be abnormal. Okay, so now we're going to work on coordination. I'm going to have you take your finger and touch it to your nose, and then touch it to my finger. Do that again. Okay, now do that a few times with your eyes closed as well. Okay, good job. So now to check coordination of your fingers, can you just go like this? And then you would do that on both hands. Now I will have you put your hands on your lap and go like this, back and forth. Good. Now I'm going to have you take your heel and move it all the way down to your great toe. Good. You have nice and even coordination bilaterally. Okay, so now we're going to be checking for sensation. So this is going to be done by the sharp and dull test. So I'm going to do it in your hands, feet, and chest. So tell me which one you feel.
Dull, dull, dull. Sharp, 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 dull.
Okay, very good. Sensation is intact. Okay, so next we're going to check vibration. So let me see your arm. Do you feel this?
Yeah.
Okay, if the patient didn't feel that, we would move up the arm. Let me see your foot. And you feel that?
Yep.
Okay, and I did that on his great toe, and I would do it on his finger. And if they couldn't feel that, we would just move up. So now I'm going to do stagnosis. So I'm going to put an object in your hand and just tell me what this object is without looking.
Sticky note.
Okay, yep. So he was able to identify the object and feel the object. So now I'm going to do a test called graphesthesia, to test for fine sensation. So I'm going to write out a number on your hand. Okay, and what number did I write?
2.
Okay, good. So you were able to discriminate what I was writing. So the next test I'm going to do is called 2 points of discrimination. It's a test for very fine sensations. So I'm going to do it on the arm. Okay. So just tell me how many points I'm touching you with. It's okay if you don't know.
2, 2.
Okay, so then I would measure that distance